Good morning, everyone. I hope you've had some time to enjoy some refreshments. My name is Jewell. I'm the proud principal here at Capitol Hill High School. I'm excited to be here with you today to recognize an innovative prevention education initiative in our school, which supports our district's dedication to wellness for our students. This is a critical program that helps hundreds of thousands of teens make smart decisions when it comes to using prescription medication, and our students are among the first in the area to complete it. This morning, we will have the chance to hear from some distinguished guests, including Oklahoma City Public Schools Superintendent Sean McDaniel, leaders from our community partner group Walmart, a student who has participated in the program, and last but not least, Oklahoma Attorney General Mike Hunter about the power of prevention education. Following the remarks, guests are invited and encouraged to participate in an interactive workshop with our students about how to help create safe communities through safe disposal practices. Thank you all for visiting Capitol Hill High School. I will now turn it over to Superintendent Sean McDaniel.
All right. Well, thank you, Principal Jewell, for your leadership and for hosting this morning's events here at Capitol Hill. So in the vision statement that we have for Oklahoma City Public Schools, we talk about things like providing access to a world-class education for our students. We talk about doing that so that as our students move through life, they can take the information we provide and make a difference in life. And many times when we think about that world-class education, we think about what's happening in the science classroom or the math classroom or the social studies classroom. But it also means that we're presenting our kids with challenges that are occurring in society and equipping them so that they can deal with those challenges. And this is an example of that. When we talk about this particular launch, this digital opportunity to address the issue of the opioid crisis in Oklahoma, in our country, we're grateful because we know that as our kids take in that information, they then can become problem solvers later. There's no doubt that this crisis has impacted all of us in some way. And so, you know, when we talk about partners like Walmart who do more than just talk about solutions, they step up to the plate and they say, we're going to fully fund this opportunity in Oklahoma City. So we're grateful for the partners that we have, especially for Walmart in this endeavor. We're grateful for Mrs. Twyla Gable. Where are you? Wave your hand again. Man, thank you for accepting this challenge and for guiding our kids. Every day we have the confidence that you're with them and that you're providing an excellent opportunity to learn about prevention and to learn more about this epidemic. We're grateful certainly for Attorney General Mike Hunter, who has taken on a fight, and he's done it with resolve. He's led the charge so that we're not only aware of the crisis, but that we have tools to use as we're fighting this fight. So Attorney General, thank you for your efforts as well. We have a couple people that I want to introduce. Before I do, I want to thank you again, all of you in the room, for making this an important day and an important issue so that we can lead that in our school system. So I want to introduce the Director of Health and Wellness for Walmart, Ms. Robin Janaway, and she has a friend, another director of one of the markets in Oklahoma City for Walmart, Shannon Griggs. Thank you for being here, and I want to turn over the podium to you guys.
Thank you.
Thank you all again for being here.
Thank you. So Walmart is proud to be here to celebrate the launch of the Prescription Drug Safety Education Program at Capitol Hill High School and other high schools across Oklahoma. Prescription drug safety is incredibly important to Walmart. As a mainstay in almost every city and town across the country, we understand the toll that prescription drug abuse takes on communities. It's exciting to be here with so many people who share our mission and recognize that we all have a role to play in tackling prescription drug abuse. One of the most important ways that we do that is in the form of education. Equipping young people with the knowledge to make good choices is a fundamental part of building healthy communities in the long term, both in Oklahoma and across the country. EverFi's prescription drug safety course is designed to do just that. To give high school students insight and tools to understand and avoid the dangers of misusing and abusing prescription drugs. Walmart is pleased to underwrite the cost of bringing this program to schools in Oklahoma, but we know that the real impact will come through all of you.
First and foremost, thank you, students, for being here and arming yourselves with the knowledge and tools to help prevent misuse and abuse so you can save lives. Thank you also to Superintendent McDaniel, Principal Jewell, and the faculty and staff at Capitol Hill High School for implementing the program and recognizing that the critical role young people play in combating what has become a national crisis. Again, thank you, Attorney General Hunter, and your team for prioritizing the fight against prescription drug abuse here in Oklahoma. In addition to empowering youth in our community through the Prescription Drug Safety Program, Walmart will continue working to protect our customers from potential prescription drug misuse and abuse. We require every pharmacist to complete a comprehensive training program covering the science of addiction, the dangers of opioids, and best practices in serving patients with pain management needs. We also work hard to make sure our pharmacy customers have information about the addiction risks associated with opioid medications and access to safe disposal options to keep medications from falling into the wrong hands. We will continue to coordinate with other stakeholders like prescribing physicians and law enforcement to keep the patients and community we serve safe. Thank you again for inviting us, and we are so excited to learn with you today and can't wait to get started. I would like to introduce our Attorney General, Mike Hunter.
Thanks very much. Well, good morning, everybody. So Superintendent, Principal Jewell, I have to say I felt a little nervous when I was looking at today's agenda, and it occurred to me that the last time I was with a superintendent and a principal, I was caught unplugging the typewriter of one of my classmates during typing class. And back then, corporal punishment was an option. So I'm recovering from that, or have recovered. Thanks for the opportunity to spend some time with you today to talk about this very important exercise. Kids, you're going to save lives by participating in this program. Your commitment to this is something that, before I say anything else, I want to honor. And it is a real privilege to be with you today. And I know what peer pressure is like. And so it really takes courage for you all to make this commitment. Again, to try to keep your classmates not only healthy, but to save their lives. So thank you very much. And thanks to the faculty and staff of Capitol Hill High School, Mr. Superintendent, Principal Jewell. Can't say enough as I began this about your willingness to show leadership with respect to this prescription drug safety program at your school. Are there members of your school board here today?
Not today.
Okay. Well, I know you're well supported in that regard. We also have a very distinguished member of the Oklahoma Commission on Opioid Abuse here today. Kids, I want you to be particularly nice to Senator Thompson. He's chairman of the Senate Appropriations and Budget Committee, and in that capacity, he makes decisions about the deployment of billions of dollars to public schools in this state. So please be solicitous of him this morning. So it's important that we have a way, and that was part of our deliberations on the commission, to educate young people about the dangers of the misuse of prescription drugs. And this program truly fulfills that critical need as recommended by the commission. Last but not least, I want to give sincere and utmost appreciation for the leadership of Walmart and EverFi.
So this conversation about getting into the program, getting the program into Oklahoma classrooms began last February when Walmart very graciously hosted me and members of my staff at their security facility in Bentonville, Arkansas. While I was there, I also had the opportunity to participate in Walmart's Conference on American Life. That conference brought together leaders from all over the country to discuss challenges facing America's families and to look at potential policy solutions. So since I've been in office, we have worked in a very focused and impactful way with regard to addressing the opioid epidemic in our state. And Walmart was one of the first corporations that stood up and said, we want to be part of the solution. And frankly, they've set an example of how companies should respond to this public health crisis. You know, it is not always easy to do the right thing. In fact, it is frequently hard to do the right thing. But again, I want to commend Walmart's continued efforts through its nationwide opioid stewardship initiative. So in Oklahoma, company representatives have met with the commission, and the opportunity to distribute the safe disposal solution known as Dispose RX to customers to get rid of unused medication at pharmacies is the reason that we're here today. And Walmart today has stepped up to ensure that students like y'all here at Capitol Hill can receive proper education on prescription drugs. So to our friends with Walmart here today, I again want to sincerely thank you and look forward to our continued partnership for many years to come. By now, everyone here likely knows some of the statistics on opioid abuse and addiction. The epidemic, the prescription opioid epidemic, has ravaged communities in our state. I wanted to share just a few of the heartbreaking reminders of what devastation means in Oklahoma. Between 2013 and 2017, an average of 21 Oklahomans died every month from an unintentional prescription opioid overdose. During the height of the epidemic, drug overdose deaths in Oklahoma increased by a factor of 8 from 1999 to 2012, surpassing even deaths attributable to car crashes. In 2018, there were 3,000 Oklahomans who were admitted to hospitals because of a drug overdose. Believe it or not, 80% of those people were there because of a prescription opioid medication overdose. For too long, Oklahoma has had one of the highest rankings for the non-medical use of painkillers, with nearly 5% of the population ages 12 and older abusing or misusing painkillers. And science tells us that teenage and adolescent years are the most critical for brain development. So exposing young people to these drugs in a way that is illicit and inappropriate can really be devastating to the future of your classmates. And opioid addiction, we've learned, doesn't discriminate with respect to age, gender, or any other demographic. Anyone can become addicted by misusing these deadly drugs. Opioid addiction literally changes the chemical makeup of your brain. And if that change occurs during vulnerable years, as we've just discussed, that result can be catastrophic. So, to you students here today, it is our greatest hope that you guard yourself from this addiction by showing the leadership with your participation in this program, helping your classmates make informed choices that will protect you and pay dividends for your futures. So prevention education for Oklahoma's youth surrounding the dangers and addictive qualities of prescription drugs is vital to overcoming the opioid epidemic in our state. And thanks to EverFi's interactive, evidence-based course, students across the state are going to be able to learn about the dangers, proper use, and safe disposal of prescription drugs. So you're being provided with the tools to make healthy, informed decisions when it comes to prescription medications. Hands-on scenarios, self-guided activities allow you to learn the facts about drugs, how to properly use and dispose of them, and how to intervene when faced with a situation involving misuse. So, thank you again to you as student volunteers, student leaders as far as I'm concerned. You'll learn about this unique program in just a few minutes. In my mind, what's most important about the program is not its uniqueness, it's that it really does work. The data that's been collected by EverFi shows us that the program has already made an impact on the lives of students across America. So you can have confidence that getting involved in this is really going to be effective. It's really going, as I said earlier, to save lives. So just quickly, I'll give you some data points with respect to the program. So far there's been 150,000 students who've completed the prescription drug safety curriculum in 2018 and 2019. And the facts speak for themselves. On average, students across 6 topics earned a 48% knowledge increase from pre to post-lesson assessments. 52% more students said it was their responsibility to prevent misuse and abuse at their schools. More than 70% of the students reported the course made them more confident in their ability to recognize and intervene when a friend may be misusing prescription drugs. It doesn't just provide you with knowledge and information. It empowers you and your friends to make responsible decisions now and in the future. So I appreciate EverFi and their continued vision and leadership in creating this software. It's making the world smarter and safer. And it is thanks, and I thank the types of partnership on display here today and the continued efforts from everyone to combat the opioid crisis. I truly believe that working together, we are having a profound impact, a positive impact on reversing the epidemic in our state. Our work is not over. Let's be clear on that. But all of us today are doing our part to keep the next generation from becoming victims of this public health crisis. It's claimed too many of our friends, neighbors, and loved ones. So thank you all again for being here today. It is my pleasure to recognize and introduce a couple of the student volunteers today. So if Jose Rios and Jose Contreras could come forward, you're on. Thank you very much.
Good morning, everybody. I'd like to start off by saying
Alright. Good morning, everybody. My name is Jose Rios. I wrote it down on my phone. What I learned about this drug prescription safety thing is that these drugs may help people with them for the help, and just because they give them to you for that reason doesn't mean that you should give them to other people, such as family or friends, because they don't also feel well, or just because they have some bad feelings as you had doesn't mean you should give it to them. They might need a different kind of medication. They might be given the wrong medication. They might be getting even more sick, or even worse, addicted. And getting addicted is much worse, and it can ruin people's lives.
hello, my name is Jose Contreras, and I learned from the program that the drugs should not be flushed down the toilet. There's a proper way to discard the drugs, because if not, it could ruin some of the environment, and that's it.
Thank you, Jose and Jose, for coming up and sharing some of the information that you guys have learned. At this point in time, we're going to transition into the workshop of the program. And so I encourage you guys to get with the kiddo and they can walk you through some of the lessons. Our facilitators from Walmart are going to be helping to spread that around. So we appreciate you guys and your presence here and the ability to spread the word. You guys getting the word out is as important as anything, and flooding the media outlets with that information. So we greatly appreciate you guys here, and we're going to turn it over, grab a kiddo, go through some worksheets, and listen to our wonderful facilitators from Walmart. Thank you.